It's a pleasure to be here. And I would like to discuss with you today about an open-ended study that we did about a method that we created to try to help people overcome their anxiety of the fear of lack of air. That we saw that can create avoidance from CBT therapy. To research if our method helps people to come back to therapy. So we discussed a little bit about dropout from therapy. We all know about it. Afterwards, I'll talk about our method. I'll show you a little bit the experience of the patients that use it. It sums up to something like 100 videos that are interactively, and I want to show you how it looks like. It's very simple. This progressive part, it has also 6 more videos that each month the patient will come back to and learn a new cognitive technique, like labeling and so on. So, our research. So we approached many CBT therapists in Israel. All of them were very reluctant to try and suggest their ex-patients to use our method. We have few criteria for the ex-patient. They needed to be people that suffered from anxiety from lack of air, which is wasn't so easy to find. And another criteria was that they needed to be ex-patients, because our method could also be used for people that had trouble in a progressive time in therapy. For example, when they wanted to have exposure. And this is also something that was very useful, but we wanted that criteria of dropouts. Okay. Any questions on the research? Okay. I would like to examine how we do a case study that shows other effects on a particular patient that tried our method. So she was 32 when she tried to use our method. She was unique in the way that she had many avoidance. She didn't have a romantic relationship at that time. She didn't work so much. She had hard time to have different relationships in her life. She was very anxious. She was suffering from panic. Before using our method, it was 3 years without therapy. She was dropping out. And when she asked in our clinic to have a therapy, we suggested her to use that before she continued the therapy, and we saw that it helped her to believe in herself. That she's capable of dealing with the anxiety from lack of air, and also she stopped avoid many things that when she came back to therapy, it was CBT therapy this time, she was very focused on other goals that were very important for her in comparing to before she tried our method. And in that years before our method, she was only focused on avoidances because of this horrible feeling for her. Another effect that we saw, that she had better adherence. She was used to exercise CBT tasks by herself. And when she got to do other tasks that wasn't related to the feeling of lack of air, it was easier for her than before. There was a positive relation between stop choking and adherence, CBT tasks. We would like to have more research about it, and as I said, we have it in English, we have it in Italian, and also the text is ready, so we can deliver it to who like to try it by himself in his research. Thank you.